Hi everyone and welcome. You're with Jackie Mayer and Marianne Accardi from MDeveryware's credentialing team. I've worked with network development, contracting, and credentialing for over 20 years. And since 2008, Marianne has been one of our credentialing managers. Marianne's a company resource in all matters involving Medicare enrollment. MDeverywhere provides cloud-based revenue cycle management technology combined with expert back-end billing and credentialing services to physicians. I'd like to thank you for joining our Express webinar today. We value your time, so we'll do our best to keep today's webinar to just 15 minutes. Our topic, Medicare revalidations and how to avoid a costly deactivation. Quick housekeeping note before I start. If you have any questions, type them into the Windows chat window on your control panel as you think of them, and we'll follow up after the webinar. And yes, everyone will receive a copy of the recorded webinar as a follow-up to today's presentation. So let's get started. Today we will first cover the Affordable Care Act, which mandated revalidations. Second, we'll review how best to handle your revalidations. Next, Marianne will offer hints and tips from the trenches. And finally, we'll share some resources to point you toward more detail and instructions. First, why are Medicare and Medicaid enrollments being revalidated? This is not the most interesting portion of our program, but it is helpful to know the history here, so no dozing off. The Patient Protection and Affordable Care Act, the ACA of 2010, included language aimed at increasing the integrity of the provider screening process with the goal of significantly reducing fraud and abuse. Detailed in the Federal Register, Volume 76, Number 22, February 2nd, 2011, and implemented on March 25th of 2011, the ACA called for all providers, meaning professional, institutional, and suppliers, enrolled after March 2011 to be revalidated under new screening guidelines. This revalidation process will be repeated every 5 years and every 3 years for DME suppliers. All providers and suppliers need to be revalidated by March of 2015. The review of ownership and interest in healthcare entities, as well as other enhancements to the enrollment process, is aimed at helping save healthcare dollars which are being wasted on fraud and abuse and which should be spent on legitimate services you're providing. You as providers are accustomed to being recredentialed by health plans and networks as a condition of ongoing participation, so why should government payers be any less concerned with network quality? So what are the new screening guidelines? There are 3 categories of risk, which are based on historical analysis of fraud and abuse trends. A, the limited risk category, which includes but is not limited to physician and non-physician practitioners, medical groups or clinics, publicly traded providers or suppliers, ambulatory surgery centers, dialysis facilities, radiation therapy centers, and skilled nursing facilities. Second, the moderate risk category includes community mental health centers, comprehensive outpatient rehab facilities, hospice organizations, IDTFs, independent clinical laboratories, and non-public, non-governmental owned affiliated ambulatory services. Finally, there is the high-risk category, including home health agencies and suppliers of durable medical equipment, prosthetics, orthotics, and supplies. Providers in all risk categories are subject to the general screening processes included licensure verification and database cross-checks with the Social Security Administration, the Office of Inspector General, the OIG, and also the NPPES profile created for your NPI. Moderate and high-risk categories can additionally be subject to pre- or post-enrollment site visits. Criminal background checks and fingerprinting are reserved for owners, managing employees, and providers in the high-risk category. According to the DOJ, in February of 2013, these efforts are paying off. In 2012, the government recovered a historic $4.2 billion. Now we will discuss the revalidation process. First, the common question providers ask is, where are the revalidation letters being sent? Well, your intermediaries began the phased rollout of revalidations in the fall of 2011. using the correspondence, special payments, or the primary practice address on file. Follow-up attempts are made by calling and mailing subsequent letters. So, what if you didn't receive a revalidation letter? Can you just send in an application? Unfortunately, you cannot be proactive. All intermediaries are asking you not to send an unsolicited revalidation application. If you're concerned that you may have missed a revalidation, call your intermediary armed with your NPI, your PTAN, and your tax ID number. There is also a monthly list published by CMS, which includes all revalidations initiated. The list covers the entire country and all provider types. We will provide links later on. Next, is there a fee for revalidation? Well, there is a $532 fee for 2013 for revalidating or enrolling a supplier and certain institutional providers. Institutional providers are defined by CMS as any provider or supplier that submits a Medicare enrollment application using the 855A, 855B, or 855S who are not physicians or other individual practitioners or physician groups. If applicable, the fee must be paid online as a condition of the application processing, and hardship requests are available. This fee is intended to cover the additional screening requirements we previously discussed. Now, do you revalidate using PAYCOS or is paper accepted? Direct revalidation using PAYCOS database is faster and it's preferred. You will need your NPI username and password to log into PAYCOS. Can't remember it? Call NPPES and have the password reset. You will need to revalidate all PTANs associated with your account that are in PAYCOS. Of course, paper applications are also accepted. Use the most current version of the application and attach your credentials as requested on the checklist. For individuals, a current state license registration, the DEA, board certificate, or the highest level of training if you're not boarded, and the driver's license if you're born in the U.S., a passport if you're not born in the U.S. No need to send a new EFT form, 855R, or a new participation form for revalidation. The exception is that if you have never enrolled in EFT, it is now mandatory. Electronic funds transfer requires a voided check or a bank letter. Make sure your name or the name on the application exactly matches the name on the NPI profile and the name listed with the Social Security Administration or with the IRS for groups. Do not fax paper applications because only original signatures will be accepted. Well, if you have multiple PTANs, how do you complete the revalidation? Or if you have both an individual and a group PTAN, can they both be done together? Well, you will receive one revalidation request for all PTANs associated with a particular NPI. Review your revalidation letter carefully, as it will list all PTANs either on the first page or the last page, depending on the intermediary. Each PTAN will need to be revalidated, and if any are unfamiliar, you will need to deactivate them. Old PTAN research has caused the most delay for our clients. You will receive a separate revalidation if you're enrolled in more than one state or with multiple intermediaries. Each letter received does require a response. Well, my payments have stopped. Could this be a revalidation issue? Well, it certainly can be. If it is possible you never updated your correspondence or pay-to address with Medicare. It is also possible that whoever is receiving your mail has not handled the letter properly. Call your intermediary at the first sign of a payment problem and ask if this is a revalidation issue. Request a copy of the letter and get the application to the intermediary immediately. Once the application is received and is in process, call to request that the payment deactivation be lifted. Some intermediaries will do this, some will not. I will now turn the presentation over to Marianne, who spends the better part of her days dealing with Medicare enrollment issues and revalidations. Marianne?
Thank you. I'd like to share some hints and tips based on our experience. When in doubt, check it out. Call your Medicare intermediary and ask if you have a revalidation request outstanding. Respond within the time frame noted on the letter or request an extension. There are instructions on the letter. Always include a cover letter with the reason for the application, including NPI and PTANs, and a copy of the revalidation letter with the application. Take the time to submit a clean application and your process will not be delayed. Zip codes must have the 4-number zip code extensions. The correspondent's contact telephone number will be called to verify the applicant can be contacted at that number, so be certain that anyone answering the phone can respond yes when asked, "Can Dr. Smith be contacted at this number?" If there is a checkbox at the end of the section related to an absence of sanctions, check the box as appropriate. You may copy the contact person page to include multiple staff members who may be helping to call on the application status, since only the owner, manager, or contact person can receive information via telephone. Always scan the final application and cover letter prior to mailing for your records. The application must have all sections complete and signatures dated. Send paper applications and attachments via post office certified mail or use another trackable shipping method. As your practice changes, make sure Medicare always has a current correspondence and pay-to address on file for you and your group. Submit a change application to update practice addresses, telephone numbers, pay-to addresses, authorized and delegated officials, and group member linkages. Remember that returned mail will result in a do not forward, or DNF, being placed on your account and claims payment will cease. The DNF will be lifted once an application is processed to update the information. Send in an 855R to remove yourself from a group when you leave or to remove providers affiliated with your group when they leave. There is always an effective date on an 855R, so don't be concerned about payment for dates of service while the affiliation was active. This will help to ensure a smooth revalidation next cycle. Respond to development letter ASAP. Development letters are sent when the application cannot be processed based on the information received or if a discrepancy is noted. There is a 30-day window for responding, so don't delay in providing additional information. Most intermediaries give you the option to track the status of your application without having to call. They now send an email with a document control number to the contact person, a tracking number or case number needed to check status. Use these tools and make sure A, the application was received, B, to check weekly to make sure it is in process, and C, to see if additional information has been requested. If you do not have a record that additional information was requested, but it says so on the web page, call the intermediary. You can finally relax once you see that your application was approved and await a welcome letter. If you use a third party for billing and credentialing, as many of our MDeverywhere clients do, please make sure the revalidation letter is forwarded to the correct person to complete the application. Confirm it was received and that the appropriate action has been taken to respond. Do not include the revalidation letters with general correspondence, and alert your staff that these are important communications. If you are revalidating a group, a facility, or a supplier owned by a corporation, you must include the information of each owner director on the application. Yes, this does mean if you are a group managed by a board of directors, every member on the board will need their personal information submitted on the application.
Thanks, Marianne. And thank you all for your time today. We've included some resources here to provide additional information and background and process. We hope you found this information helpful. I'd like to just take a minute to talk about MDeverywhere for those of you who may not be familiar with us. We provide cloud-based revenue cycle management technology and expert back-end billing and credentialing services to physicians. We provide service to approximately 3,500 physicians nationwide, ranging from solo practices to large groups, mid-sized groups, and faculty practice groups, as well as hospital organizations. We provide our clients with an online patient portal called Patient First, which keeps their patients in touch with their physicians and provides an easy way for patients to make online payments. I'm particularly proud of the top-notch credentialing services we provide. We'll follow up on any questions submitted after the webinar. A link to today's presentation will be sent to you via email for all attendees. We'll be hosting the same presentation in 2 weeks. If you would like an invitation or would like to invite a friend, please contact me or Ellen. Marianne and I would like to thank you for your time today, and have a great day.
The organizer has ended the session, and this call will be disconnected.